Hello, everyone. I'm Lachelle Freeman, and I am the project manager here, stepping in for Dana Esby today for office hours. And today we are going to talk about professional responsibilities, confidentiality, boundaries, and ethics. And it is going to be our own Gail Cormier, who is the project director, who will be presenting this to us today. So, as you guys know, our events are sponsored by SAMHSA. And just because these are our views that we are discussing today, and they're not exclusively any of SAMHSA's beliefs. So, housekeeping information. You know that your microphones will be muted at entry, and you will be able to unmute during the discussion portion of our webinar. Also, the session is being recorded and it will be available on NASDAQ's website within 14 days of the close of this presentation. If you have questions during the webinar, please use the chat or use the raise hand feature during our discussion to have your microphone unmuted. And information about participant certificates, will be sent in a follow-up email. Participants must complete a brief survey to gain access to the certificates. And last, if you have questions after this session, you can really, Dana's email is on here, but you can contact all of us at NASDAQ if you need to. And NASDAQ, what does NASDAQ offer? NASDAQ supports families and caregivers by providing technical assistance and training to educators, providers, family workforce, and organizations who support them. This includes, but is not limited to, of course, information, training, resources, and workforce development. We also offer technical assistance, and it helps us. Sometimes we are able to help other organizations connect with each other or with different systems. We can help you with strategies to reach and partner with family members and best practices around effective referral development, exploration of resources, development of refining state-based certification process, and also building organizational strategies to sustain and grow the family peer workforce. If you go to our NASDAQ, NASDAQ.org, you'll see a request technical assistance if you are interested in doing any of that. So always during our webinars and our presentation, NASDAQ uses family-driven language. So it's going to be trauma responsive, strength-based, avoids blaming caregivers. It's inclusive, it's person first, it's respectful, non-judgmental, and consistent with your actions. So for the office hours series, the goal really for this series was to support family peers to build skills within the 5 core competencies to best support families through the lifespan and increase acceptance of mental health and substance use challenges. It's also to inspire peers to challenge family serving systems by advocating for family-driven language, care, policies, and systems. So the last goal is to provide resources, tools, and opportunities for peer learning to increase self-efficacy within the 5 core competencies. And during the series, and you can find these recordings on our website, we've already went through wellness and resiliency, affecting change, resources and natural supports, system knowledge and navigation. And today we're going to learn about professional responsibilities. So I'm going to turn this over to Gail Cormier. She will introduce herself and she will begin with the learning objectives.
Hello. Here I am. Hi, welcome. And I'm Gail Cormier, if you don't know. The director of the National Family Support Technical Assistance Center. And I am welcoming you to our very last office hour. And because the last office hour, you get moved to present on my favorite piece of the competencies, and that's professional responsibilities. So let's look at the learning objectives today. At the end of today's office hour, you will be able to learn how following the Code of Ethics increases trust between family peers and families, which strengthens really the acceptance of mental health and or substance use support. We're going to understand the importance of maintaining families, confidentiality, and health boundaries to develop authentic partnerships that really lead to social justice. And of course, we're going to gain tools and strategies to develop healthy boundaries with families and maintain their privacy and follow the code of ethics and learn about the difference in privacy regulations for children under and over 18 years of age. And I will tell you, that is an important skill to learn. And I, as a parent of three grown children over the age of 18, was shocked when my oldest child turned 18 and there were different rules. And that is a surprising fact that we'll discuss today too. But first, we're going to have a little Mentimeter. So I want you to either go to the menti.com site, or you can actually, do we have the code for Menti? Or you can hit the link that's
Yes,
in
No, I'm going
it's
to
in the
share.
chat.
I'm going to share to the actual Mentimeter.
okay. So what is the situation where your boundaries were tested while doing your work? And you can put a sentence in there, a word, please feel free.
Are you able to see this QR code?
I am not.
I
Okay.
can, Lachelle. I can see
Okay.
it.
Okay. Gail, are you able to see the Mentimeter?
And now I see one answer, so
Yes.
we're a
Yes.
little quiet, but clients calling after hours and weekends. I was tempted to develop a friendship with a family member. Oh, that we all are at times. Clients asking personal questions during appointments and deciding what to disclose and what not to. And when the family needs food, oh yeah, these are all hot tugging, really questions. Parent calling to ask about their adult child. Oh, how many of you, like me as an adult mother, would love to do that? And I hope it's okay with the people who are putting in the questions, but I'm going to change the word client to individuals or families because that's the preferred language of the National Federation of Families and the Technical Assistance Center. So I'm going to say families reaching out through personal Facebook pages and parents calling to ask about adult child. When I wound up supporting my neighbor professionally, ooh, that's a good one. Families needing more from me outside of my hours. Families offering me food during my visit.
And I think the last one that I see is families asking for money.
And yeah. All
So
right.
give me 1 second and I will get your slides back up.
Okay. I know the the one that I saw that really struck me is when families offer you food during a meeting. Now, that's a really interesting one to have a conversation with because in some cultures, eating food or being offered is a sense of creating that trust. And I'm wondering what other people think about. Is that crossing a boundary? How do you feel about that? If you feel comfortable to eat the food or you feel safe eating their food, how do you feel about it? Anyone? While we're waiting for the PowerPoint to come up, I'd love to. It might be seen as disrespectful to turn food down. Now, I'm Italian, and in our family, the first thing families as Italians do is offer food. So you're right. But I also want you to know it's okay to turn it down because you may not feel safe or comfortable enough, or you may not even like what they're serving. But we should come up with an idea or how to respond to that. And Kristen says her company doesn't allow it. That's interesting. Okay. So let's talk about ethics, and we'll get back to some of these comments as we continue. So ethics refers to a set of principles, rules, or standards for a person's conduct in the profession. For family peer specialists, it's how we conduct ourselves when we're working with parents and caregivers and their families. Slide. So here is the National Federation of Families Code of Ethics. I'm going to give you a second to read it. And Candace, while we're reading it, Candace says she has food allergies, so it makes it easy for me. Yeah, that is perfect. Why don't we put in the chat, which code of ethics speaks to you the most? I can tell you that sharing my experience as a family member caregiver with others, that one actually speaks to me the most. And of course, sharing appropriately, non-judgmental, absolutely. I personally try to go in and I tell my staff that I work with to go in and everybody's going to be judgmental. That's nature and humanity, but we have to really be conscious of that and make sure that we're really looking at things as a blank slate without judgment. Sharing my experience. Someone said commitment to honesty. If you're not honest, the families and the individuals you're working with will pick up on that. Building partnerships. Building partnerships is exactly what being a family peer specialist is all about. We partner with those families together so we can help navigate and support. And sometimes a family peer specialist will be supporting a family, but you become that trusting relationship where the support is mutual. Continue. Next slide. So the first principle, integrity. I want you to do the same thing here. Let's look at the 6 principles of integrity and tell me which one speaks to you. I personally love number 2, champion family members' ethical decision-making and personal responsibilities, consistent with their culture, values, and beliefs. That talks about that's social justice. Number 3, champion family members' voices and articulate their values related to their loved ones' behavioral health. Absolutely. I see a lot of 3s and 2s here. I do not believe. Let's see, 6, communicate information in ways that are developmental and culturally appropriate. And we all know that being culturally fluid is something that we're learning, and we're never ever perfect, but to actually let the families lead in their culture and understand what their developmental process is. Number 5, demonstrate respect for cultural-based values of family members engaged in peer support. Oh, that's wonderful. I see everybody has at least picked one area here. Let's go to the next slide. So as we continue, this is more integrity. So what do 7 and 12? What speaks to you here? I'll tell you one. Number 12. That speaks to me not only as a family peer specialist, but as a supervisor in the past of family peer specialists. Our families that we serve and support become very important to us. And we know it, we are invested. But we have to realize that when we have to be able to give our families their wings and understand that sometimes they're going to leave long before you feel that they could. It's their decision. And that is a really hard thing. So terminating a relationship when it becomes reasonably clear that a peer relationship is no longer desired by that family member. Sometimes you have to walk away, but you can always say, you can leave, but we have an open door policy. You can come back at any time. Now, of course, if your organization is limited to that, you have to be upfront and say you have to go through, an assessment process and an intake process all over again. But some family peer organizations, especially when they're family run, will actually have that open door policy where you leave us and you can come back whenever you feel it's time. Next, next slide, please. So safety. And this one here may even speak to the food question. But which one here speaks to you the most in safety? Now I can tell you, number 6, what's number 6 here? Ensure clarity about my role and the role of family members. Absolutely, Kristen. 8, abstain from engaging in intimate, emotional, or physical relationship with family members engaged in a peer support relationship. Oh, very critical. Yes. Respect the privacy of agencies and refrain from distributing internal or draft documents or shared private or internal conversations. Absolutely. I think number 2, that one speaks to me the loudest, and I see that Kelly has that on there. Maintain confidentiality and personal and professional communication. Absolutely. And that confidentiality goes far beyond just maintaining it within you and that individual family you're supporting. It's something you do not discuss with your coworkers. If you're having a special team meeting in the office and everybody understands that. But if you're at lunch with a coworker, you do not discuss a family member in public ever. That's breaking confidentiality. You never know who's going to sit in the booth behind you. Or I have actually had a couple of staff breaking confidentiality in a bathroom. They were in 2 different stalls talking over each other about a family member. You don't know who's in that bathroom. We need that confidentiality to create that safety, that place for safety. Samantha, you put number 8? Yes. Let's go to the next slide. And professional responsibility. Stay informed on current research, policy, and developments. Absolutely. Oh, I love that you're all taking this training. That means you're working to stay informed. Take those trainings, update your skills. Things are so fluid and fast moving in our country today and in our community and in the mental health and the peer support field that things change constantly. And things that might have been the current research or policies or developments back in 2011, they don't be now. So you always upgrade your skills. That's really important to stay informed. Engage in a supportive relationship that includes skill building, not exceeding my scope of practice, experience, training, education, or competence. And I will tell you, sometimes the role of a family peer specialist may merge into a care coordinator or a case manager, and we have to make sure we maintain what our role is clearly and not merging into another role. That's peer drift, but it's also maintaining that professional responsibility to give in those families and individuals you work with the right message and the clear support. Kristen says, I'm not a supervisor, but I think number 6 is very important for me. And that says, in the role of a supervisor consultant, be responsible for maintaining the quality of my own skills. Absolutely. If you're a supervisor, it doesn't mean you know everything. You need, as much as the people you support and the staff you work with, you need to always maintain those skills too. And here's a big one. always, always give credit to persons for published or unpublished original ideas. Absolutely. If we're writing, if we're quoting, we always need to give credit to who was the originator. Next set of slides. And of course, you could find the Code of Ethics on the National Federation of Families website, but here's the certification responsibilities for the Code of Ethics. Now, I don't know how many people here have their national certification or plan to get their national certification, which, by the way, this training here will count for an hour and a half of your training towards the national certification. But let's talk about the responsibilities. When you get your national certification, and it's from here, the Federation of Families, you must remain on you remain current on your certification fees. Always, the utmost important is to maintain the Code of Ethics that we just described, credential appropriately, build partnerships with others who are involved in the support of our families, cooperate with an ethics investigation. Luckily, we haven't had many of those at all, if any, that I am aware of. And notify the National Federation of any legal action. Well, these are all things that are standard if you're certified. In the chat, let me know how many people are nationally certified from the National Federation. Can you put a yes or a thumbs up or something in the chat? Diane was, yeah. Renee. Yeah. How many people here? Bethany. Candace, you're working on it. Awesome, Candace. How many people are certified at their state? Some state levels have certification. Michaela isn't. Kay Burke isn't. And you know what? It's no problem. Someone's state certified here. Diane is certified in Iowa. And, it depends on your state. Some states rely on the National Federation of Families certification, and others rely on the state certification. I think whichever one it is, it gives you that seal of approval when you're working, that at least you're certified by a state entity or a national entity, saying that that at least you know those basic competencies and you understand the Code of Ethics, and that's who you are. Christy from Ohio and Iowa. So there's a lot state and nationally certified. I'm so glad to see you. This is how you keep your skills up. Next slide, please. So confidentiality, the big one. We talked a little bit about it just because of the questions in the chat. And, like I said, confidentiality is important. I know that this means to be confidential and not talking out in a public space. It means keeping the families you support and what's going on in their lives within your own framework. It means to talk only with the colleagues that you're allowed to talk to. It means getting families permissions to talk to people outside of your organization or that may help with those connections for those families, but you need that written permission. It's that confidentiality that creates trust, basic. Now, of course, there's the exception of this, and that's duty to report. And that's initiated when you have reasonable grounds to suspect that a child is or may be in need of protection. Now, here's something. Please, if at all possible or whenever you can, you must encourage the parent to self-report or at least have that family peer specialist, as a family peer specialist, have that family or individual with you and understanding that you're reporting. Now, you're not always able to do that, but honestly, in 98% of the time, you can say, if you have that really good trusting relationship, hey, I am really sorry, but this makes me uneasy. This is unsafe for a child. We need to report. Would you like to make the phone call? And I will sit with you. And if that can't be done, you may sit here and hear everything I say. Now, that's not 100%. You're never 100% able to do that. But hopefully you can most of the time. And how do people feel about that? Do you agree with me? Put it in the chat. In my agency, I'm a mandated reporter. Everybody is a mandated reporter if you're working as a family peer specialist. It's how you report. You know, do you think you create a trusting relationship if you see something that you need to report and you don't talk to that family? Oh, absolutely, Brittany. What about when the child is abusing the mother physically? Oh, that actually is a reason to report in many states. And yes, you can tell the mother, you're being abused. I feel uncomfortable. You can get hurt. Someone get hurt really bad. This isn't good for anyone. We're going to need to report. Tricky situations, but in any case, if you can do it with the parent, that is the best way. We're getting some great comments in here. Mandated reporter, always work with the parent to report. Absolutely, Emery. Meet with the DSS. And I will tell you something. DSS does not want to take children away unless they absolutely have to. And it has to be in a really serious situation. A lot of times, if you report with the care and the respect that you will give to that family, there are times where the family A might get mad at you for a while, but they will come back to you if you do it with trust. But the other thing is, sometimes when you report, there are different services that actually can help and support the families even more. And it could be something that is good. And there's a competency infographic for this. Okay, next slide, please. So boundaries, always a situation. What are the guidelines established by legal, ethical, and professional boundaries that support effective work as a family peer specialist without becoming personally entangled in family dynamics and needs? Now, this is tricky. Family peer specialists have to work with that balance. And when I say balance, it is we're not a therapist, we're not a friend. We're sort of in between. We're their support person. We're there to be their ear when they're having struggles and they want to call you and they're experiencing some kind of crisis. And we can talk about crisis reporting later. But sometimes they use you as your ear for you to say, yes, I've walked that walk. And that is what you're supposed to do. That is your role. As that trust becomes greater, it's that as you support over the years, you can't help but feel friendly to a person. You're human. That's why we have to let people go when it's time to let go. And that kind of rips my heart out sometimes. But it's that family dynamic. We have to really walk that balance. And I think we saw in the Code of Ethics, never, ever, ever get into a personal relationship, date the father, date the mother. Never, never do that. Another thing for boundaries is, and this is an experience I had with one of my staff. One of my staff members wanted to open up a bakery, and he was supporting this family who actually had quite a bit of money, and the family was very grateful for all the support. And he did help that family, and he helped that child, and the child got a better education because he was at every IEP meeting. The family decided wanted to invest in his bakery. Now, what do you think of that? Is that a boundaries issue, guys? Let's put it in the chat. Yes, it sure is. Yes. I think that would be crossing the dual relationships. Absolutely. We can't. Taking food is one thing. Taking money, having a relationship, those are clear infractions of boundaries. Next slide, please. Boundaries in the family peer support role, always be clear on our role as a professional and not a natural support. No, we are not going to get called at 9 o'clock to babysit your child because you have an emergency. We can connect you with natural supports that might be able to do that, but we're not your on-call 24/7. And you have to be clear with that boundary. If Diane said if the family is grateful, they can make a contribution to the agency, that can happen, but let's hope that would happen after the relationship ended, not during. Do something with someone to promote their own skill development instead of doing it for them. Absolutely. Well, we will support, stand by, sometimes role model, but we have to give families and individuals their wings to be able to do that and cheer them on as cheerleaders. Do not jump to solutions too quickly to fix a situation or make assumptions. Okay, guys, I'm going to be honest with you. This is the one I have the hardest problem with. You can see what's going on. You know what's going on, and you want to fix it. And I will tell you, I have a hard time. I always want to jump into solutions. So I know that that's one of my weaknesses, but you can't. You have to let families succeed, make their own decisions. And sometimes in your head is, oh my God, that's the worst decision. It's never going to work. But they have to experience that themselves. And of course, you cannot be a superhero 24/7. I have actually had to give staff little superhero capes with a big X on it because we have so many family members, and even myself. Our families are important. Our youth and our children are important, and we want them to succeed. But we can't be superheroes. We can't do 24/7. We can't stop everything we're doing with this family because that family also needs us. Oh, run out of a meeting with a policy person because the family needs us. No, we have to make sure that roles and responsibilities are clear, that boundaries are clear, and as much as we want to be there 24/7 for your families and individuals, we cannot be. And it's like being a parent. You can't always be there for your child, but you can be there times. And it's okay to be there to support, but not all the time. Next slide. Setting and maintaining boundaries. Well, I think judging from the comments and in the chat here, we recognize where boundaries have been crossed. Then we have to check our own selves, and we also have to sometimes check our peers, our peer workers. Discuss the crossed boundaries effect. What does it happen when you cross your boundaries? That destroys trust in relationship. Communicate, communicate, communicate. Make an agreement to maintain the boundary. Now, in the chat, I'm going to ask a question. A lot of family-run organizations, a lot of family peer specialists, a lot of social workers, who has an agreement within their work when you do intake with the families or the individuals? You show them a roles and responsibilities. This is what my role is, and this is what my responsibilities are. This is what your role is, and this is what your responsibilities are. And where the boundaries are. Who has that checklist or that written agreement? I know I always did wherever I worked. And if you don't, check in with the Technical Assistance Center here, and we'll give you a copy of a draft one that you can, look at, take, use. That's best practice for organizations. And yes, it is very beneficial. And always regularly check in. And be honest with yourself too. Slide, which I appreciate. So as I said earlier, this is our last office hour of this fiscal year in this season. We will be back starting in September, but we take July and August off for planning and to get ready for the following fiscal year. When you fill out the surveys today, put in some topics that you would like to have discussed next year for office hours, because this is when we're planning. We're planning over the summer and we're getting our topics going. So I'd love to hear from you so we can make these even more worthwhile just for you. So in that case, we'll see you in the fall. And of course, coming up, if you like our events, we're having a SAMHSA sponsor event, not an office hour, not with NASDAQ, but with the Federation of Families. And that's going to be in July. Next slide. And here's my contact information. Dana isn't here, but if you want to email her and wish her a happy honeymoon and great marriage, feel free. There's her contact information. And of course, our principal investigator and our National Federation of Families executive director, Linda Gagne, always drop us a line, tell us how we're doing, let us know, ask us any questions. NASDAQ's technical assistance is available all 12 months of the year, so feel free to go to our website and request TA, whether it's for an individual or for a community or an organization, it's okay. And as you leave today, we're asking, like we always do, to please, as you leave, you'll be taken to a survey, and that survey helps us fulfill our SAMHSA obligation and tells everybody and us how we're doing, and hopefully so we can continue funding. So I appreciate your responses on the survey. And once you finish the survey, you should be taken to another link that you can download your certificate of participation. And so you have that. If you have any troubles at all, you met Lachelle this afternoon. You can always email her and ask her for any questions. But hopefully it'll all work. And again, you filling out those surveys are really important. So please, please, please fill out those surveys. And also have a great summer off. And we'll see you in September. Oh, make sure and I hope to see some of you at least at the National Federation of Families conference in November, which is going to be in Orlando. So it should be good.